Hi, good evening, and thank you so much for joining us tonight. We are so excited to be spending the next hour or so with you discussing something that we are very passionate about, donor eggs. Our hope for you at the end of this discussion is that you receive valuable information and feel ready to engage in the next steps for your future family. My name is Becca Murillo, and I am a registered nurse. I have worked as an IVF nurse for 11 years and recently joined Donor Egg Bank USA as a physician relations manager. As an IVF nurse, I worked with hundreds of families, and I'm honored to speak with you tonight about what it means to use donor eggs. Let me introduce to you Donor Egg Bank's co-founder and executive vice president, Heidi Hayes. Heidi is joining us tonight to not only discuss the process of using donor eggs, but also to share her personal story on how she came to use donor eggs to complete her family.
Thank you, Becca. I look forward to talking with everyone tonight. So let's get started.
We will be taking questions at the end of the presentation. There should be a Q&A button below that you can submit your questions, and all questions are anonymous. So let's talk a little bit about our objectives for this evening. Coming to terms with the diagnosis. For many, this is the hardest step. Some of you may have known for quite some time that using donor egg would be your best success. For others, you may have received this information last month or maybe last week. And let me just pause here and say that wherever you are in your journey, however you feel right now, that's okay. Some of you may be excited and ready to hit the ground running, while others may be, unsure or sad. And these are all normal emotions, and there's no right or wrong way to feel. I encourage you to talk with your physician and talk with your partner and really get those answers to your questions so you feel really confident about taking next steps in your fertility treatment. I'd also like to add that if your clinic provides a wellness coach or maybe a counselor, think about reaching out to them and speaking with him or her, and that will help you navigate these emotions and face some of the common fears. So what about taking the first steps in choosing a donor? How do you do that? How do you map out the game plan for finances and timing? What are the financial plans? And then looking towards the future.
So I want to start out by telling you a little bit about my story because I think a number of you probably have some similar stories. Even though I know all of our journeys are different and they're all very individual, I think you might identify with some of the emotions that I went through in the process. So my husband and I, we were in our late 20s, early 30s, all excited about having children. We tried and tried and it just wasn't working for us. So we were referred to a reproductive endocrinologist. And we started to have IVF and we got pregnant twice. We were pretty excited. But each time we were told by our nurse to be cautiously optimistic. And inevitably, we never saw a heartbeat by the time we got to the clinical pregnancy point. We were pretty devastated. On all, we did 11 cycles of IVF and frozen embryo transfers. We were pretty emotionally spent. And at that point, we recognized that IVF wasn't going to work for us. And we were told about donor egg at this time. We considered that option, but I just really believed in my heart that it was probably me and that I wouldn't be able to carry a baby. So why should we waste our hard-earned funds on donor egg? So we ended up pursuing an adoption. We did an international adoption. This is us actually at the Washington, D.C. airport, bringing home our son. We were elated, so excited. but we knew that our family wasn't complete. So we went and wanted to adopt a girl. So this is our daughter, who we loved tremendously. We were so excited to bring her home. But at the timing in which we were bringing her home, the laws changed. And we ended up finding ourselves in an adoption, I could probably say nightmare, of waiting to try to get her. So we visited her frequently. We saw her take her first steps. We were there for her first birthday. Just loved spending time with her. This picture is a really emotional picture for me because this is the last time I ever saw her. We tracked this adoption for 6 painful years, hoping that she would one day come home, and she never did come home. And what I really recognized at this point is that adoption wasn't the sure thing that I thought it was. And I wasn't complete. And we were back to square one. I felt personally like a failure. Here I had failed IVF. Here I had failed adoption. Like, what more was there? Nothing was going to work for me. And I was devastated and pretty hopeless. But I also knew I wasn't complete. And so we had to go back and say, what do we do next? Do we do donor egg or do we do another adoption? So I just want to walk you through some of our thought processes, because if you're looking at donor egg, it's probably also likely that you're looking at adoption too. You know, the costs are actually similar. By the time you add it all up, the home studies, the fingerprints, the legal fees, it gets quite expensive. 10 to 20% of adoptions fail. You know, birth mothers have a right to change their mind. Or in my case, with an international adoption, the laws changed, and many of us did not bring home our children. You know, I liked the fact when I looked at donor egg, the opportunity to be in control. You know, throughout the IVF process and the adoption process, somebody else was making the decisions. Somebody else was going to determine the timing. With donor egg, it would be my decision on which donor we chose, and it would also be my decision when we got started. And I liked the idea of having that kind of control. The wait times are long with adoption. We would be years without knowing if we were going to be successful. With egg donation, we knew that we would have the dreaded 2-week wait, but I thought I could get through 2 weeks. I also gave some thought to the donor, that she was really only giving me one cell. And even though that's a special cell, it was really my body that would weave that baby together. And I would get the opportunity to carry the pregnancy, even though at the time I was a little worried that I wasn't able to carry the pregnancy, but I would if we went forward. And my husband would have an opportunity to have a genetic connection. And then I would also be able to bond during the pregnancy versus afterwards. It did take longer to bond with our son at the adoption phase.
So what are some of the reasons for egg donation? Some of these may look familiar to you. Decreased ovarian function. This is a decrease in the quality or the quantity of your eggs. Premature ovarian failure. This is the reduced function of the ovaries under the age of 40. And sometimes this is related to autoimmune disorders or caused by genetic factors. Maybe you have a family history of genetic abnormalities or genetic diseases. Failure of other treatments. Many of you have gone through multiple fertility treatments without success. Or maybe you have gotten pregnant, but you suffered a pregnancy loss. Donor Egg Bank USA is all encompassing, servicing our LGBTQ+ community. So why donor eggs work? Well, women are born with all the eggs we're ever going to have. And as we age, our ovarian reserve diminishes. Our peak fertility actually occurs sometime between our 20s and early 30s. And really, after we hit about 30, you see a rapid decline beginning. So in the last slide, we saw the downward trend, and in this slide, you're going to see a rapid rise. And what we're looking at here is as we become less young, the rate for miscarriage increases. And most miscarriages occur because of chromosomally abnormal pregnancies. So what are some of the advantages of using frozen donor eggs? You will receive 5 to 8 mature eggs. These eggs are already frozen and ready to ship. You may question why there's not a fixed number listed here and why there's a range. And that's because every woman provides mature eggs at different numbers. So we have used an algorithm to ensure we're only using the best mature eggs. And when you look at our website and you choose your donor, you will see exactly how many mature eggs are available in that egg lot. There's no need for synchronization with frozen donor eggs versus a fresh cycle. So there's no chance that your donor is going to drop out. Maybe she's not taking her medications like she should be. There's more control of the cycle, and the timing is really more convenient for you, which is also great too if you're using a gestational carrier to carry the pregnancy. And so there's more control on cycle timing there. We have a wide variety of donors to select from, over 300 plus donors on our database. And using frozen eggs is less expensive than a fresh cycle.
So I'll let you know a little secret. I don't share it all the time, but the decision to use donor egg was a quick one for my husband. He was completely on board. For me, it took longer. I really grappled with it, and I wondered, would I love this baby as much? And the altruism of adoption. I liked that. But I ended up thinking of donor egg and wanting to go this direction. And I really applaud Marsha Cross. She says, I don't like the average woman being misled into thinking that fertility is something that goes on forever. When a woman gets older, they get donor eggs, which doesn't make the baby any less beautiful or perfect. One's own eggs only last so long. And there were so many advantages to donor egg that it just really won me over. So when I also considered the success rates of donor eggs, it was really exciting to see. When we look at our all-time data, we have a lot of experience at Donor Egg Bank USA. We've done many cycles. We're averaging 6.6 eggs in an egg lot. We have a pregnancy rate in excess of 65% right now, actually 69% in 2019, a clinical pregnancy rate of 60%, and 64% of cycles had more than one embryo to transfer. Most of them did freeze that extra embryo because we are proponents of a single embryo transfer. Miscarries are normal. It's going to happen. But you should know that once you get to that clinical pregnancy rate, the miscarry rate drops significantly. And then we have an ongoing and live birth rate of 52% per embryo transfer.
So let's talk a little bit about choosing an egg donor. And how hard is it to find one? So our donor database has over 300 donors. And for those of you that are joining us from Canada, we know that Health Canada recently changed their guidelines and regulations for egg donors. And I want to assure you that we also have over 250 Canadian eligible donors as well to choose from. So these young ladies, these donors, go through extensive testing and screening. To give you an idea, for every 100 applications that come through, only 1 to 2 donors will actually make it to retrieval. So again, this gives you an idea of the thorough testing and the screening and really the dedication and commitment that these ladies have to make it to retrieval. Some of the things they also go through, they'll go through drug screening, they'll go through extensive medical history review, multi-generational family review, genetic testing and screening, infectious diseases, and all of them do see a mental health specialist. So there is some psychological screening and counseling as well.
So I wanted to share just some tips for selecting a donor. And the first thing I want to tell you is make this an enjoyable process. When you have children, you're going to want to tell them about the night that you selected their donor. That's if you choose to tell. But for my husband and I, we had a nice bottle of wine and we looked at all the different donors, and it was just really fun to look at the wide variety. And, you know, we really wanted to play to some of our weaknesses as well as to our strengths. So, you know, you should expect to match the most important items that you want, whether that be height or eye color. But you're going to have to make some compromises on some of the less important issues. For example, you know, look for education potential, not that they have a PhD. These are young women. They're in college or they're just graduating from college. They're still determining who they want to be in their lifetime. So you're going to have to make some of those compromises. You know, remember that everyone has imperfections. There's no mini you out there. There's no perfect child. There's no perfect parent. So we just want to look at the donor and know that these are real people with real lives. They do amazing things, and, you know, they make a mistake here or there along the way too. And then matching the blood type is not important if you are going to tell your child that they were born of donor egg. If this is something that you hope to keep secret, you will want to match the blood type, and we do put that on our website. But I would just caution you for a moment to at least tell your pediatrician, your medical provider that you use donor egg so that your child receives the appropriate care. And you're going to want to share the profile and some of the medical history of the donor with your care provider. And then one small other tip is with the DNA banks out there, you should know that there is a possibility that your donor conceived child could find out that they're donor conceived. So I think it's always best to be open and transparent as much as possible.
So let's talk a little bit about the financial options. Our first plan is called the single egg lot plan. Here you will receive 5 to 8 mature eggs. The cost for this plan is $14,500 US. This guarantees 1 or more blastocyst embryo. We also offer a double egg lot plan where you will receive 2 egg lots. This plan does provide a discount on the eggs and also guarantees at least 2 blastocysts within those combined sets of eggs. While we don't really promote the use of PGTA with our donor eggs, if it is indicated by your physician or something that you're interested in, we do have a euploid quality guarantee rider that can be purchased separately. So let's move into our single cycle plan. Here is where we combine the cost of the eggs with the treatment. We work with your physician and decrease the cost of the eggs and the treatment to come up with a one-time upfront cost that is more reasonable. Another benefit to this plan is both the eggs and the treatment is protected. And what I mean by that is if for some reason the egg lot did not perform as we had hoped, or maybe fertilization didn't occur, and the cycle is canceled. Had you been in a single egg lot or even a double egg lot plan, you may have to pay the clinic for that treatment again. But with this plan, the treatment is guaranteed. The cost of this plan varies amongst the fertility clinics because every physician and fertility clinic they have their own cost. But if you contact us, we can certainly let you know what the cost of this plan would be for you. Now let's talk about the Assured Refund Plan. This is a personal favorite of mine. I have held many patients' hands over the last 11 years as they walked through their journey of building a family. And I have to say there was a sense of relief when my patients were enrolled in this program. And I say that because I knew that they would have multiple tries, multiple opportunities. And I also knew that Donor Egg Bank USA would be the one to carry the financial risk. The Assured Refund Plan provides you with a safety net that if you don't come home with a baby, you will receive 100% of your money back. This plan offers up to 6 egg lots with unlimited frozen egg embryo transfers. Not only does this plan protect you while you're going through treatment with your clinic, but it also protects you against miscarriages and late-term pregnancy losses. This is a plan that you need to qualify for, but I'll tell you it's a very simple process. We will work with your clinic and your physician to obtain your medical records and history. And 95% of the patients that apply for this program do qualify. And 92% bring home a baby, which is really exciting. I also want to mention that if you choose to withdraw from this program, you will receive 50% of your money back. We have found that some physicians prefer to keep the egg and the treatment costs separate. And we've also found that some patients have insurance and they'd like to use that towards their the cost of the treatment. But we still wanted to be able to offer a live birth guarantee for patients that fall into this category. And so we came up with the multi-egg lot refund plan. This plan is very similar to Assured Refund with a couple of key differences. You will receive up to 4 lots of eggs, and the cost of the treatment is paid directly to the clinic. So it's paid separately to the clinic. The cost for this plan is $30,000 US, which really is the cost of 2 egg lots, except that you don't get the guarantee with a double egg lot as you would with the multi-egg lot refund plan. So you would get a full refund if you don't bring a baby home after 4 cycles in this plan. And similar to Assured Refund, should you choose to withdraw from this program, you would receive 50% of your money back. And we have one more benefit that we feel really strongly about. After all the effort, the time, the money, the love, and energy that you've put into having this baby, you want to protect this baby for a lifetime. And we are offering free blood and tissue processing through our sister company, Cord Blood Registry. And Cord Blood Registry is the largest cord blood program in the United States. And it's free to you, and storage is included for the first year.
Thank you, Becca. So let me just tell you some of the common fears that you'll have, and I'm hoping we've actually answered most of these for you. So first of all, will I love the baby? Absolutely, you're going to love this baby. This is a baby that you've worked hard to receive. You chose the donor, you carried the pregnancy, and you will bond and adore and love this child. And I just want to emphasize again, because if you were like me, I really believed that I wasn't able to carry that pregnancy. It was really my eggs that were not working. My uterus was just fine. And for most of you, you'll find that that's the case as well. So will everyone know that you used an egg donor? It's really up to you to make the determination who you tell and when you tell. Let me tell you, even the people you tell will forget. My mother has said more than once to me something about my children and who they inherited it from on her side of the family. And I always kind of smile and I remind her, but everyone forgets. And I have this thought that privacy is different from secrecy. You can choose to be private about this, and you don't have to be secret about it. Can you emotionally and physically do another cycle? I didn't think I could. I really didn't think I had it in me to do another cycle after my failed adoption. But I'm telling you, pull yourself up by the bootstraps. You can do it. Get the courage to try again. Having a baby is about perseverance, and you're going to have to find that emotional ability within you to move forward. Will you find a donor that you like? Absolutely. We have 300 donors to choose from. The database goes up and down every single day. Donors come onto the catalog, donors will come off the catalog. Our catalog is available 24/7. When you speak with a member of our team and you enroll in our process, you will be able to select that donor any time of the day or the night. And you should just be aware that we have business that's also international. Well, you might be sleeping here in the United States, somebody in Australia might be choosing their donor. So just be aware of that. And can you afford it? I would start out by registering on the website. It's free. It's free to register. It is free to enroll until you decide to match with a donor. And then we're going to work with you because we want you to be able to afford the best option that's right for you. Which plan do you choose? That's going to be an individual decision that you're going to have to make for your family. We'll give you all the pros and the cons to each of the plans. But I'm telling you, the Assure refund and the multi-egg lot refund plan, the ability to pay once and then just know that it's our job, it's your physician's job to make that happen for you, will alleviate you of a lot of stress. We also have financing, I should also share, with multiple programs, and you can find that on our website too. So here is probably not a beautiful picture of me, but I ended up having twins. We put back, in the words of my doctor, actually, 2 crappy looking embryos, and they made 2 beautiful babies. So I'm just telling you to trust the process. I remember stressing when I found out that the polar bodies weren't where they were supposed to be and that the embryos weren't developing like we'd like. I was a bit of a basket case. And what I really needed to do was just to relax and trust the process. Donor eggs are good eggs. And these are young, vibrant women. And here I ended up with 2 lovely children. So I just wanted to share this photo because my family was complete. I remember seeing the world in a different way. I remember driving to work one day and recognizing, seeing all these purple flowers that I thought I'd never seen before. And I think it's because I had let go of the despair and I felt this fullness in my heart that I finally had the family that I wanted. And so I just share with you that we each have our own journey. But what does bind us together is that deep desire to be a parent and our willingness to persevere to make our dreams come true.
Thank you, Heidi. So we just want to thank each and every one of you for joining us tonight. If you're able to stay, we'll answer some of the questions that we've received. And if you haven't already, please register for a free account on our website, and all the information is listed here on the slide. And we also have case managers available right now until 9 p.m. Eastern Standard Time. So if you want to call in and ask some questions there too, we're happy to answer that for you. Right, let's take a look at some questions here.
I will share that many of you have asked if this recording will be available, and it will be available. We'll put it on our website, so you'll have it.
So one of the questions is, roughly how long does the process take from start to finish? Meaning from first contact to receiving the egg allotment at the doctor's office. So really, I'll take this question, Heidi. Really, it just depends on how much screening and testing you've done with your clinic. But if you have been screened and you've talked with the doctor and they've recommended donor egg as the best success for you, as soon as you find a donor and you're ready to go, from start to finish, from starting that medication until pregnancy test, it's really about 6 to 8 weeks.
So the next question is, how often is the donor egg bank refreshed? And if you find a donor that you like, but then their egg lot is gone, is it possible to get another one in the future? So we are putting donors up as soon as they have retrievals. This happens any time of the week. We do send out a donor alert one time a month, and we will put a number of donors up at the timing of the donor alert. But if a donor that you like is gone, feel free to contact us. There may be an additional egg lot available, and we can put your name on that egg lot as a first priority. But I'm just going to tell you, if you find the donor you love, select her. You can always decide after a day that you don't want to move forward with that donor, but finding the donor you like, I think, is half the battle. So just move forward if you find one.
We have another question asking if there's any sort of guarantee on quality. We pride ourselves on quality with our donor eggs, and yes, there is a guarantee. We have a blastocyst guarantee in place for each egg lot that you purchase. So what that means is that you will have one or more blastocysts per egg lot for either a transfer or to biopsy or to freeze. So if we do not meet that guarantee, you will receive a replacement lot.
So somebody is asking a question regarding the single cycle plan. You know, how does that work? And do you own any leftover eggs to try again? And how much does that typically cost? The single cycle plan is the cost of the eggs as well as the treatment from your doctor, just bundled together. We've lowered the cost of those eggs, and we've negotiated with your doctor for a lower cost as well. So if you're thinking about moving forward, I would recommend you consider the single cycle. If you produce more than one blastocyst, and that happens frequently, we know, extra in the single cycle plan to have those cryopreserved, and they are your property. So you can move forward with another try. In the assured refund plan, as well as the multi-egg lot refund plan, if you have extra embryos and you're already pregnant and you deliver your baby, you can also move forward with those embryos at another time. They're your property to move forward with. And I am excited to say we actually do have a parent with Donor Egg Bank USA that have had 3 children from one egg lot.
There are a couple of questions on PGTA, also PGS, and on frozen donor egg, and is it a good idea, and how does it occur? This is something that you should talk with your physician about. We typically don't, there are a lot of clinics that don't recommend PGTA with donor eggs. The reason for that are, these are young women, healthy women. The quality of the eggs should be good. And so PGTA is not something that we really worry about with this age group. Sometimes there are other indications for testing an embryo. And so we recommend talking through that discussion with your physician.
So we have a Canadian resident asking about the changes in the Canadian law with Health Canada. What are the changes, and are you able to use any donor if they're not Canadian? So first of all, I'm really excited that Health Canada, I think, did a really great job in putting their law into place. It did take effect in February of 2020. The law requires infectious disease testing, genetic screening. You know, it's just a method for Health Canada to have control over the donor eggs as well as the donor sperm that enter the country to make sure that it meets the Canadian standard. And we do comply with all of the Canadian standards and Health Canada law. And we have been shipping eggs into Canada since 2012. We work with all of the major centers in Canada. And I'm sure that if we don't work with your center, we would be able to establish a relationship.
We do have a question about payment plans, and we do work with several companies that can assist with setting something up for payment plans and financing. If you call in and speak with one of our case managers, they are very well versed with all of this information and can certainly give you all of the information on that.
Let me answer a few more questions that are coming from our Canadian clients. One is, how does the eggs and treatment work in Canada? It actually works in Canada exactly as it works in the United States. We offer all of the same plans in Canada. We've been offering the Assured Refund plan for many years. And what we've done, because we had Quebec at one point that had coverage, and now we have Ontario with coverage. It's been exciting to see. We've worked with your clinics that your first cycle you can utilize your coverage with our Assured Refund plan, so that you're getting the benefit of your coverage to lower the cost as well as the benefit of the packages.
Okay, I'm just working through here. So we have a question about what are the qualifications for the Assured program and how does it work to apply? It's very simple. You can, when you talk with our case manager and with your physician, you can just let us know that you're interested in the Assured Refund program, and we will reach out to your clinic. We provide them with an evaluation form, which really we're just trying to get some information on your past history, any IVF cycles you may have done in the past, what the sperm sample looks like, if you've had any surgeries, anything like that. And so we're just trying to gather as much data as we can, and then we'll review that data.
So somebody is asking, you know, we're willing to guarantee a baby in the Assured Refund plan. You know, what about the other plans? You know, the other plans we guarantee a blastocyst embryo, but only in the Assured Refund plan and the multi-egg lot refund plan do we actually guarantee a baby, because we know that some individuals are going to get pregnant and have that baby on that very first try, right? And I'm just going to be honest with you. They're going to pay too much to have that baby. But I always tell those people, jump up and down and scream hallelujah. This is not the plan that you want to go all 6 cycles in. Because I don't know about you, but every time I had a miscarry or every time I had a negative pregnancy, I laid in bed for a full day and wept. So if you get the baby earlier on the very first try, be happy, because you've also subsidized that couple that are going to go all 6 tries. We have people that have gone all 6 tries. And those individuals, we've put out $125,000, $150,000 of treatment costs. And we've actually had to refund some of them the plan on top of that. The whole Assured Refund plan goal is to protect people from the downside, because you can go through another treatment process, I didn't get any refund for all the IVF I did. I didn't get a refund for the baby that I lost in the adoption process. And the Assured Refund Plan is designed to give you that financial security.
There are several questions asking about a copy of the slides, and as we had mentioned, if you missed it, we will have this available. I'm not sure, Heidi, where we will
It
put
will
this.
be on the website. It'll get posted to the website.
Okay.
So we don't have a plan for gender selection or family balancing. In those cases, I highly recommend you consider doing a double egg lot plan, because you're going to need a few more eggs to make embryos with to hopefully get the sex that you are looking for.
We have a question. Are the qualifications the same for the Assured Refund Plan and the multi-egg lot plan? Yes, we use the same evaluation form. We're gathering the same information for these programs.
So what is the success rate for pregnancy on the first try versus the second? It is the same rate as we have for all the other plans. So every donor available, every egg lot available is available in the Assured Refund Plan, in the egg lot only plan, and in every plan we offer. So that success rate of having a baby is 47% in 2019. It's not cumulative. So that's the one thing to recognize. What we found is actually the second try has a much lower success rate. And then the third try is even a lower success rate. The fourth try is lower. And it's because there are those couples that for whatever reason are not going to be successful. You know, 92% of people will go home with a baby, 8% will not. And some of that is not explained as to why those 8% won't. But if you think about it, every single cycle, you have more and more people that are having complications in the process of getting pregnant. But the sad part of this is you don't know if you're one of them, which is why Becca said she always liked it when her patients chose the Assured Refund Plan, because she knew that if they turned out to be one of those individuals, it was going to be okay.
We have another question asking about Canadian eligible donors, and if there's something in particular you have to do to choose a Canadian eligible donor. When you log in and you register on the website and you select that you are receiving treatment in Canada, the donors that you will be able to see and choose from are all Canadian eligible. So you don't have to worry about that.
And you'll also notice, just to piggyback on what Becca said, we also ask you if you're getting treatment in New York or in California. And it's because those states also require different licenses. And we want to make sure that the eggs coming into that program are under the appropriate licenses and jurisdictions.
Do you work with most fertility clinics, or are there some that you don't work with? I will tell you that we work with over 240 reputable clinics across the country and into Canada. And if we don't currently ship to a clinic that you are receiving treatment at, we will happily reach out to them and establish a partnership with them. So if you are interested in moving forward with one of our donor and one of our plans, that's our job to reach out to your clinic, and we'll be more than happy to discuss that with them.
So there's the question. I'm wondering on the timeline for Canada because of, let's see, because I'm wondering if I need to order eggs and then have them fertilized before finding a surrogate, or should I have a surrogate first if it takes a long time? I would do both simultaneously. You're going to have a surrogate search. It will take a while to do that. At the same time, you can get your eggs ordered. We can go ahead and ship them. You can have them inseminated, the embryos created, and then you'll know what you have. It will also help you determine with your surrogate what your contract is going to look like. So I would do them both at the same time, and it will save you time overall.
We have a question about, it says, if me and my husband both want to fertilize eggs, is there an option for that? Absolutely. Our double egg lot plan would be perfect for this. And that way you have a double set of eggs and can use both sperm sources. And I also didn't mention, I don't believe in the presentation, but if you're using a gestational carrier for your pregnancy, the gestational carrier can also be eligible for the assured refund plan as well as the multi-egg lot refund plan.
So I'm not going to read this question because it's very long. I'm just going to answer it. I think many of you will have these questions. You know, the overall point here is what's included in the assured refund plan. And this is in the assured refund plan, the recipient monitoring that's coming in to have your lining checks, your egg warming, insemination of those eggs with ICSI, embryo culture, and then ultimately the transfer are all included, as well as the freezing of any excess embryos. Your pregnancy test is not included, nor is your OB sonogram if you are successful. Those are usually covered under your pregnancy benefits with your insurance plan. In addition, in the assured refund plan, all your frozen embryo transfer cycles are also included. So let's say you have a cycle and you have 2 blastocysts. You transfer the first one and you're not successful. You would then come back in and do your frozen embryo transfer cycle, and we hope you'd be successful with that one. If not, we will send you another egg lot, and we will continue to move forward in that way until we have you pregnant, or for whatever reason, we refund your money back to you. So the other point that was made in this question is that we mentioned that our slide says there's a 50% refund if you leave the assured refund plan, but our website says it's an 80%. Thank you for pointing that out. We switched over to the 50% refund as of February 1st of this year. So we'll have to go back to our team and make sure that the website gets corrected as well. And then you ask, how long does that process take? Typically, if you've done your diagnostic work already with your physician, it just takes a little bit for the evaluation to come in. And then if you choose your eggs, you're typically having your transfer within a month and a half to 2 months. If you haven't done your diagnostic work yet, it will take longer because we're going to need to have that for your evaluation form.
We have a question about genetic flags or carrier status on the donors, and how can we determine if the donor is the right one. So on the website, you will be able to see if the donor is a genetic carrier for a particular disorder. And it is really hard these ladies are screened with a large panel, and it's not uncommon to be a carrier of something. And so what is recommended is that the male sperm source be tested for the same genetic flag that the donor has. So just to make sure that you're not both carriers of the same thing. And this is something that you'll want to speak with your clinic about. Generally, they're comparing the donor genetics with the sperm source report. So you'll just want to make sure that you speak with your physician and with your nurse and make sure that the male source has been screened for the same genetic flag.
So many of you are asking for a copy of the slides. Let us do one better. If you contact the team or send an email to the info@DonorEggBankUSA, we need to know who you're seeing, which clinic you're seeing. We will give you the financial guide for that clinic, and it will be able to give you all of the pricing as well as a little more detail on each of the plans too. The question is, how can you tell if a donor is a proven donor? In the search criteria, choose proven donor. Proven donors on our website, we have had ongoing pregnancies with those donors, and therefore they're proven. But I just want to tell you this. It's really more important to find the donor that you like than to know that she's proven, because every proven donor was once a first-time donor.
There's a question, how many eggs are in a single egg lot? That varies between 5 to 8 mature eggs per lot.
The qualifications for the Assured Refund Plan and the multi-egg lot plan are the same. And we're also asked if we have African Americans in our donor pool, and absolutely we do. We have the benefit of having different programs that we've partnered with across the United States and even internationally to ensure that we have a very diverse pool of donors.
We have a question about the difference between Assured Refund Plan and multi-egg lot plan, or are they one and the same? They're very similar in the sense that there is a live birth guarantee, but there is a difference. The Assured Refund Plan bundles the egg lot with the treatment cycles. The Assured Refund is up to 6 egg lots with unlimited frozen embryo transfers. The multi-egg lot plan separates the two. So you will pay for the eggs and for the live birth guarantee to us at Donor Egg Bank, but you'll pay for the treatment with your physician in your clinic. Also, if you have insurance, you could use the multi-egg lot plan, and insurance would pay for the treatment part.
So I want to go back to Canada for just a minute because there seems to be some confusion. So let me try to clear it up. If you're Canadian, when you register on our website, you're just going to mention that you are seeking services in Canada. The only donors you will see are those that meet the Canada Health Guidelines. The guidelines are very similar to the United States guidelines, but unlike the United States, they've specified certain criteria for like when the physical has to happen. Here in the United States, it's up to 6 months. In Canada, it's a shorter period of time. All the donors must have hemoglobinopathy, regardless of what their ethnicity is. Here in the United States, for a period of time, we only did those testings based on the ethnicity. So there's just some minor differences, but the donors are well screened. We do molecular genetic screening. The panels vary by donor because over time, you know, the panels have gotten larger. Typically, they average between 170 to 280 different disorders that are screened. And I also say, don't let it scare you if a donor is a carrier. Most of us are carriers. We're all carriers of probably something. And, you know, it's really easy just to have the male sperm donor or partner screened for that carrier as well. And then it will be very safe to move forward.
I have a question. Can you consider working with a fertility clinic that you work with but don't have an assured plan agreement? Absolutely. And you're asking specifically about Brigham Women's Hospital, and we actually do work closely with them.
Someone's asking, do we work with most fertility clinics? Absolutely, we do. We've never had a clinic refuse to work with us. Typically, it's just a matter of putting a contract in place and getting their embryologist comfortable with the warming of our eggs. The protocols do vary sometimes between the different egg banks.
Do we need a surrogate before signing up for the Assured Refund program? Yes, you do, because we actually need to, that evaluation form that we talked about, that would be what we need to gather the medical data and the information on your carrier.
Okay, I think we've tackled most of these questions. Let me just tackle this one quickly. Can two women split an egg lot? You can choose to split an egg lot if you're doing the egg lot only plan, but all of those eggs would need to be warmed at the same time for us to make sure that they meet the guarantee. But that could be a good option, let's say for a lesbian couple that both want a chance to carry the baby. I think it's a great idea. Most of the donors are genetic carriers. How can we determine if the donor is the right one? We are very transparent in everything we do. We do have the carrier status available to you. You'll just need to have testing done, screening done, and as long as you're not carriers for the same item, then that's a great donor to move forward with. Are you seeing any other major topics, Becca, that we've missed? I'm seeing a lot of duplicates.
Yeah, I think we've tackled most of these. And if we missed anything, please feel free to reach out to us via email or by phone. We have, again, case managers that are more than happy to help answer these questions for you and help guide you through this process.
And let me answer just one more question, if you don't mind, Becca, before we go.
Sure.
Because I think it is, I just want to share it. Heidi, can you share how you chose your donor? Like I said, I made it a fun thing, but I'm a horrible singer. And so I really wanted to have a donor that had singing ability. But let me tell you that my daughter sings all the time. She's decided that she wants to be an opera singer. We are listening to opera vocals throughout the house. She sings in the shower. So, be careful what you wish for. Lots of singing happening in my house.
That's great.
So it was just wonderful to be with everyone tonight. Like Becca said, go ahead and give us a call, reach out to one of the case managers. We're here to help you. We're here to support you. I co-founded Donor Egg Bank USA because I've walked in your shoes. I know that it can be a difficult process, and we just want to help you through this process and help you be successful. Thank you so much for joining us tonight.
Thank you. Have a great evening. Bye-bye.
Bye.